To open the bag, pull the strip at the top of the bag and take the SPUR II out. If the SPUR II is packed in a compressed state, unfold the SPUR II by pulling on the patient valve and the inlet valve. Do not pull the reservoir bag. Tearing may occur. Before use, test that the SPUR II is functioning correctly. The right testing procedure can be seen in paragraph 8 in the directions for use. The SPUR II can be used together with a PEEP valve to increase the expiration pressure. To use the PEEP valve, remove the splash guard and attach the PEEP valve to the expiratory connector. Attach the mask to the patient valve if the SPUR II is not intended for use with an endotracheal tube. When the SPUR II has been prepared and tested ready for use, it can be used for ventilating the patient. Hold the mask with one hand so that it covers the patient's nose and mouth, and start ventilating with the other hand. By using the swivel attached to the patient valve, the SPUR II can be placed in a 360-degree angle in relation to the patient. To ensure a better grip, the SPUR II Adult and the SPUR II Pediatric are equipped with a handle. If needed, the handle can be turned away by holding the patient valve with one hand and turning the handle away with the other. If it is necessary to clean the patient valve due to foreign bodies, take off the splash guard, unscrew the expiratory connector, and take out the red valve. Clean the patient valve, the splash guard, the expiratory connector, and the red valve. After cleaning, put the red valve back into the patient valve. Then screw the expiratory connector back on and attach the splash guard. Ventilation can now be resumed. The O2 tube can be connected with an oxygen source. The oxygen supply is working correctly if the reservoir bag is inflated. To avoid excessive pressure in the lungs, all infant and pediatric versions are equipped with a pressure limiting valve. The pressure limiting valve can be overridden either by putting one finger over the valve or by using the override clip attached above the valve. The SPUR II Infant and the SPUR II Pediatric can be equipped with a manometer giving visual control of the ventilation pressure. The SPUR II Infant and Pediatric versions are equipped with an adapter for the manometer port, enabling different types of pressure gauge tubing. When using an endotracheal tube, the Mediport can be used to administer medication without disconnecting the SPUR II from the tube. The administration of medication could be done by removing the Mediport cap, mounting the syringe in the Mediport, and injecting the medication. When medication has been injected, ventilate 5 to 10 times in quick succession. Medication can also be administered by sticking the needle through the middle of the Mediport cap and injecting the medication. When medication has been injected, ventilate 5 to 10 times in quick succession. When ventilation has been terminated, put the SPUR II and accessories back into the carrier bag and keep it close to the patient for possible later use. Throw away the SPUR II if it is not intended for any further use on that specific patient. For further questions regarding the SPUR II, consult the directions for use placed in the carrier bag.